Welcome back to the Taiwan Outlook. I'm your host, Wu Ruiguo. In this segment, we will continue our conversation with the Honorable Ye Ching-Chuan, Minister of Health of the Republic of China. Minister, we understand 2009 is a very important year for Taiwan's international space because after 38 years of absence from UN-affiliated activities and also after 12 years of failed attempts to join the WHA, the World Health Assembly, that this year, in April, that you led a delegation as the invited observer to the World Health Assembly. This is a historic moment for Taiwan's international space. Can you then describe for us and categorize for us the experience for Taiwan on the international stage on a very important occasion when there's public health threat from the influenza A and also our contribution to the World Health community in terms of sharing our experiences in fighting SARS and also in fighting the influenza A this year.
Yeah, the most impressive talk to our friend.
Yes.
There's a friend that come to the delegation and
yes.
say, finally you are here.
Yes.
You should be here earlier.
Yeah, you're the lucky charm.
No. That's most of the member that what they think about. We should be one of the participants
exactly.
of this WHA. And why is that? Because we are part of the world. The world. We need the WHO, but the WHO also need Taiwan to participate.
Precisely.
Yeah, and most important is not we sit there. That's not important. We have the chance to talk to all the member states, including United States, Japan, European EU, and the most important country,
yes.
and to share our experience.
Exactly.
Taiwan is a small country, but we have some important achievement. They are very interested. For example, American,
yes.
they are doing their health reform.
Yes.
And what Obama's proposal is Taiwan model.
Yes,
they
exactly.
They are looking for a single pipe healthcare system. That's what they want. And for some small country, we are the 11th country who have ability to produce a vaccine, especially this flu vaccine.
Yes.
And we express that we are willing to share with our vaccine to help those countries who don't have any ability or don't have money to buy vaccine. That's most important that the world community they found there's a friend join us, and we found that we can share our experience. We can get help with from WHO. For example, we have ability to produce vaccine, but our safety and efficacy. We need to confirm from WHO so that we can donate our vaccine to
other
WHO. With their confirm their certification, we can be part of the world. If we are isolated, those vaccines can only use by 23 million people.
Exactly.
We
cannot
wish
be
to
a part of it.
We are not part of the world. That's the most important meaning of
behind the participation. Yes, and also, Minister, we understand that, of course, in the past year, there's been a lot of progress in cross-strait relations. And we also saw on television that you had a very brief encounter with your counterpart from China. And how would you describe your conversation, the brief conversation that you had with the Chinese health minister? And also, how would you describe the atmosphere that you had in your conversation?
Yeah, actually, that's just a conversation. Minister Chen Zhu from mainland China, he's a gentleman. He's not a communist.
No.
He is a scientist. He's a hematologist and used to work for a very famous hospital, Ruijin in Shanghai. That's just a conversation, but we made the arrangement to have about 1 hour formal dialogue.
One, yes.
Yeah, that's arranged later on,
Okay.
not
in front of
public.
the TV
Yeah.
cameras, yes.
Actually, we talk about the cooperation between the cross-trade, about disease control,
Yes.
vaccine development.
Okay.
Of course, we are doing the H1N1 flu vaccine, but more important is EV71, the 长病毒.
Oh, okay.
China also have that problem.
Yes.
And the problem is focused in Asia, East Asia,
Yes.
Japan, China, Taiwan, Korea.
Yes.
We don't know why, but
okay.
that's one area we can cooperate. And they are interested in cancer prevention.
Yes.
We have much progress in this field. For example, anti-smoking.
Yes.
China have a lot, a long step to a long.
And they can learn from us.
Yeah,
yes.
they can learn from us, and we have very good. 这个6分钟卫生 you know what is
yes,
that? The cervical cancer screening and breast cancer screening.
Yes.
And we are doing much better than China, and they are interested in this issue. And about the food safety,
it's we mentioned earlier. Yes.
That's the general agreement, but we do not sign anything. But later on, when we come back, our staff from CDC, from Bureau of Health Promotion, and other FDA contact with their counterpart separately. So I think there will be good progress in the year ahead.
Yes, and Minister, now we are observer at the WHA. Of course, people will be wondering if we can be more integrated into the WHO and taking part in the various meetings, in the various groups on the research and development of medicine and vaccination and things. Do you think that in the coming months or coming years that we can be more integrated into the World Health community?
Yeah, up to now, our CDC have almost no problem to communicate with WHO, the Secretariat.
Yes.
And they send us the seed virus to produce the vaccine.
Yes.
And we have a teleconference about every 2 weeks about the vaccine development.
Yes.
And there's no problem in this field. But there's in WHO, they have many activities.
Yes.
And about the FCTC, that is anti-smoking conference.
Okay.
GOM, that InfoSem, that's food safety, and another one is fake drug.
Okay.
We are not able to attend those mechanisms yet.
Yes. Okay.
But it takes time to deal with each step by step.
Yes.
I think we are optimistic about this issue.
Yes.
To participate in WHO activity one by one.
Yes.
One
step at a time. Yes.
Yeah, we cannot automatically attend all the activities.
Yes.
But we try our best, and currently, up to now, we don't have a problem to face with those.
Yeah.
We will solve the problem.
Yes. Yeah. Okay. And also, after your delegation has returned to Taipei, according to a number of different polls, I think over 70% of the people approve your performance and also Taiwan's participation at this year's WHA. And I think also very important is for the Taiwan medical community that we're able to make this breakthrough this year. And can you share with us then the reaction that you've received from the medical community, including the doctors, the nurses, the health administrators? They, very much. We can imagine that very much welcome. But what's the general reaction that they have in terms of Taiwan becoming part of this world health community?
Yeah, I think the medical society, including doctor, nurses, pharmaceutical pharmacists, they know this issue more than ordinary people. So
of course.
Most of them are excited about this progress.
Yes.
Of course, some of them will complain that why you use this name Chinese Taipei, why you don't use Taiwan, Republic of China or something. But that's the reality.
Of course.
It's a compromise. We are not satisfied with the arrangement, the name Chinese Taipei, but it is an acceptable arrangement.
Yes.
To participate is more important than anything.
Exactly.
To prove our existence.
Yes.
If we cannot show up, we cannot talk to our counterparts.
Yes.
You will be isolated.
Yes.
No, it's no use. You will be isolated forever. And we have chance to talk to our counterparts.
Yes.
Not mainland China only.
U.S., Japan.
Yes. And the most exciting thing, I think, I talked to the Catherine Sebelius, the new Secretary of Health and Human Services in the United States.
Obama.
And she is very elegant lady.
Yes.
She promised to help Taiwan to produce vaccine, to upgrade our FDA food safety.
Okay.
And she have two staff from FDA and CDC.
Okay.
And we have very good contact, direct contact with CDC and FDA in the United States. Okay. That's a major progress in Taiwan.
All right. Thank you very much, Minister. We're going to take another break, and we'll be right back to the Taiwan Outlook, and we'll continue this conversation with the Honorable Ye Jingchuan, Minister of Health of the Republic of China. We'll be back in 3 minutes.